Hello guys, very good evening to all of you, and I hope all of you guys can hear me. And we are beginning with week 1, general pharmacology. Pravanam Mahato Johar, hi everyone. No sound, guys. Are you guys able to hear me? Sound आ रही है कि नहीं आ रही? Good evening, guys. Are you? Guys, very good evening to all of you, and I hope all of you guys can hear me. All right, guys. So good evening to all of you. Good evening, good evening, good evening to all of you. So देखो, these sessions that I do weekly pharmacology is specifically aimed at revising pharma every day 1 to 2 hours, then next day revise, re-revise. I hope you guys have been following it, right? Excellent, excellent guys. तो वेरी गुड गाइस. सो आई होप आप लोग पिछले हफ्ते जी फार्मा पढ़े होंगे, राइट? सो जी फार्मा में अपना रोज़ का काम होता है कि 2 घंटा, 1 घंटा, 1.5 घंटा पढ़ना, फिर पिछले दिन का रिवाइज करना और उससे पिछले दिन का री रिवाइज करना. That is what we need to do in. So the most important part is from Monday to Saturday. So tell me guys, were you able to do G Pharma in the last 1 week? Because that is the most important thing. MCQs I'll discuss, new MCQs I'll discuss, but the most part here is to do G Pharma from Monday to Saturday, right guys? So anyways, I hope you guys have completed your target last week. In these sessions, I'll discuss MCQs which are new one. They're not PYQs. MCQs मैं जो डिस्कस करूंगा वो PYQs नहीं है, वो नए क्वेश्चन हैं that I make. They would be similar to the last year's weekly pharmacology, but they would not be same. Some would be same, but I would change the options and the question. I would change the option and the question, right? Okay, so let's begin. Okay, so here goes the first question. For approval of a generic drug, which of the following is taken into consideration? One touch से पढ़ा है, कहीं से भी पढ़ा हो, right? You have read from One Touch, wherever, whichever other faculty, if you are following. Schedule. I have been posting schedule on Instagram, guys. I have been posting schedule on Instagram. This is my handle, doc@docpharmaniac, right? @docpharmaniac. So you can use One Touch. Here our aim is to discuss new MCQs, potentially new MCQs, 1 hour every day. And I'll ask new MCQs. I'll not discuss those MCQs which are PYQs or which are present in the apps, right? So I make them specifically for this session. So for approval of a generic drug, which of the following is taken into consideration? Bioavailability, bioequivalence, therapeutic index, therapeutic window. So guys, what do you think is the answer here? Now see, these sessions can be attended both by the NEETPG, INICET aspirants as well as FMGE aspirants. FMG, your exam, the MCQs level is higher. Nowadays, it is the MCQs are as good as the NEETPG MCQs, right? All right, so what is the answer here, guys? All right, so I can see most of you have given, 90% have given the right answer, and I'm so happy. So answer is bioequivalence. Is not bioavailability, is not therapeutic index, it's not therapeutic window. So bioequivalence, what does it mean? So suppose there is a branded drug. What is the meaning of a branded drug? Branded drug means a company who invented the drug, right? A company who invents the drug is called as branded drug. And the company gets a patent for 20 years. Now, what is the meaning of patent? Nobody else can copy that drug. Now, after 20 years, when the patent expires करेगा, someone can copy. And this copy drug is called as generic drug, right? So for example, there is a company like SmithKline, right? GlaxoSmithKline, GSK from US. It made a new drug, and after 20 years, Cipla would copy that drug, and that is called a generic drug. So Indian market is mostly flooded with generic drugs. We are known for why we call India as the world's pharmacy, because we produce most of the generic drugs, right? Now, whenever generic drugs are produced, how would the drug regulating authority, who is the drug regulating authority in India? Tell me, who approves drug in India? India में drug कौन approve करता है? Who approves drug in India? Give me some answers. Who approves drugs in India? Is it FDA or is it CDSCO? Who approves drug in India? Is it FDA or is it CDSCO? Who approves drug in India? FDA or CDSCO? So I'm asking one more question, right? DGHS, Director General of Health Service, would be wrong. Now guys, remember, FDA approves drugs in USA. FDA approves drugs in USA, right? So FDA will not be the answer. In India, drug is approved by CDSCO. Now, so when the generic drug would be, will apply to CDSCO for approval, CDSCO will ask for a certificate. That certificate is certificate of bioequivalence. Now, what is the meaning of bioequivalence? When two drugs, they have same extent as well as rate of absorption, right? So extent of absorption, matlab how much is absorbed, what percentage is absorbed, 10%, 20%, 30%, 50%. That is your bioavailability or area under the curve. So this is PYQ, right? Extent of absorption, area under the curve. Whereas rate of absorption, it is Tmax. Rate of absorption, it is Tmax, right? Rate of absorption. So for two drugs to be bioequivalent, what must be same? The extent of absorption as well as rate of absorption. Now, if you ask me, sir, how to remember this? See, we can remember this as simply, for example, let me take as rate, right? Rate. So rate of absorption, Tmax. Extent of absorption, area under the curve. So this is a simple strategy. This is a simple strategy to remember how to remember the rate, right? So rate of absorption, Tmax, area under the curve, extent of absorption. I hope this is clear, guys. Now let's move on to the next question. A patient on loperamide for treatment of diarrhea. He was started on an antiarrhythmic and developed respiratory depression. What is a causative drug? What is a causative drug, right? So look at the options. Lidocaine, magnesium sulfate, quinidine, amiodarone. Again, I asked a similar MCQ last year in Weekly Pharma. This year, the question stem is little different and the options are different, right? And the options are different. So what I'm trying to say is the topics would remain same. Topics would remain same. Questions will differ. In any exam, in NEETPG, INICET, FMGE, the topics would be same, right? So what is the answer? Lidocaine, magnesium sulfate, quinidine, amiodarone. Good evening, guys. All of you who are joining late also, good evening to all of you. All right, so usually you see what happens is loperamide. Loperamide is an opioid, right? So loperamide, whenever I give loperamide, I act upon GIT. And if this is my blood-brain barrier, then what happens with loperamide? Loperamide would act upon GIT and it crosses the blood-brain barrier, right? But it does not remain or does not go into the brain. The reason being, there are efflux pumps. These are called as P-glycoprotein pumps. Now look carefully what happens is these efflux pumps will throw loperamide out. So drug efflux, this is called as drug efflux. So drug efflux is one of the reasons why drugs cannot cross the blood-brain barrier. So एक reason है जिससे drug blood-brain barrier को cross नहीं कर सकते. That is called as drug efflux. Another reason why drug cannot cross is because they are lipid insoluble. Now what happens if any drug can block this P-glycoprotein? That's the it is blocked by quinidine. So as many of you guys have given the answer, quinidine is the right answer. Quinidine blocks P-glycoprotein pump, and that is the reason why now this will be blocked. This efflux is blocked. Loperamide will now be in the brain, and being an opioid, it would cause respiratory depression, right? Very good, guys. So all of you are excellent. Most of you have given the answer right. So I've understood the concept because see, P-glycoprotein MCQs they are asking. New MCQs are being asked on P-glycoprotein. Now people would say that the exam is easy and you don't need to read complicated stuff and all, and that is all nonsense, right? You have to prepare for the stars. So at least you land on the moon, right? Digoxin is a drug that needs to be given as loading dose as it is distributed into, right? So good evening, guys. Good evening, whoever has joined late. Good evening to all of you. So I've already completed 2 questions, right? So digoxin is a drug that needs to be given as loading dose as it is distributed into adipose tissue, skeletal muscle, myocardium, liver. It's a very simple MCQ. It's a very simple MCQ, but there is a deep understanding in this MCQ, right? So again, this is a new MCQ. This is a new MCQ, and though I've discussed this last year. Last year I did discuss. All right, guys, come on. What is the answer? Digoxin is a drug that needs to be given in loading dose as it is distributed into which part of the body? See, if you select one option, skeletal muscle and myocardium both cannot be the answer. Skeletal muscle and myocardium both cannot be the answer. Now, usually see why I have given adipose tissue in the option, because most drugs, they are distributed into adipose tissue, most drugs, because of high lipid solubility, right? But here adipose tissue will not be the answer. The reason being, digoxin is not that a highly lipid soluble drug. Then it might come into my mind that, okay, then digoxin acts on the heart, probably myocardium is the answer. No, myocardium will not be the answer. The reason being, how much is volume of myocardium to consider for distribution is very less. So now what am I left with? Try to understand. Myocardium has sodium, potassium, ATPase pumps, and these pumps are also present in the skeletal muscle, which I have in abundance. So your answer is skeletal muscle, guys. Answer is skeletal muscle. And that is the reason why. Now, what is the clinical point I need to understand? Why, as a clinician, you will calculate loading dose. And for most drugs, you'll calculate loading dose based upon the total body mass, total weight, right? Whereas here for digoxin, you'll calculate it based upon lean body mass and not total body mass, right? Yeah, heart बहुत छोटा है, दिल बड़ा छोटा है, right? Liver will not be the answer. Liver is not known for distribution. See here, adipose tissue would be a good answer, but it is not the right answer, right? It's not a stupid answer, it's a good answer. Anyways, now moving on. A drug with volume of distribution of 100 liters means. So again, this is a new MCQ that I made today, and I have not discussed this ever, right? A drug with volume of distribution of 100 liters means drug is 20 times less in plasma than tissue, drug is 20 times more in plasma than tissue, drug is 100 times less in plasma than tissue, drug is 100 times more in plasma than tissue. Now see, this is a little bit of mathematics, right? थोड़ा सा mathematics है. अमन सिंह, क्या समझ नहीं आया? क्या समझ नहीं आया? कौन सा समझ नहीं आया? राइट. सो एनीवे, समझ नहीं समझ में आया तो याद रख लेना, क्विनिडीन इज एन इनहिबिटर ऑफ पीक ग्लाइकोप्रोटीन पंप. ऑलराइट, व्हाट इज द आंसर? अब देखो इसमें क्या आंसर होगा. वैसे बताओ, ये क्वेश्चन बहुत आसान है. दिस इज अ वेरी इजी एमसीक्यू. This is not at all a difficult MCQ. The reason, you have to understand the basics of volume of distribution. If you have attended my class, either offline or online in Marrow, you know that I've taught you guys what is volume of distribution. So you guys, all right. So if you don't know, let me teach you guys what is volume of distribution. See, it is the previous question. No, this is not the PYQ. What is loading dose? Okay, I'll explain what is loading dose. Now see, suppose this is the human body, right? So for this question, let me explain, guys. This is, suppose, the human body, and this is your tissue. This is your tissue, right? Organs and tissues. So these are my organs and tissues, and this is my atriovenous circulation. Suppose this is AV, the atriovenous circulation or systemic circulation, and we have plasma here. We have plasma here, and suppose the plasma is 5 liters. Suppose I have 5 liters of plasma, that is constant. 5 liters of plasma is constant. Now, let me teach you volume of distribution, right? Suppose 5 milligrams of drug are present in 5 liters of plasma, right? So now I'm going to ask you a simple mathematical question. Try to answer this, pay attention. 5 milligrams needs 5 liters. How many liters would be required if the tissue 100 milligrams of drug is present in tissue? Suppose the drug is high volume of distribution and drug is 100 milligrams in tissue. So how many liters would be required for 100 milligrams? Simple question. For 5 milligrams of drug, I need 5 liters of plasma. 100 milligrams is present in tissue, right? 100 milligrams is present in tissue. For 100 milligrams, how many liters of plasma would be required? भाई 5 मिलीग्राम के लिए 5 लीटर प्लाज्मा चाहिए. 100 मिलीग्राम के लिए कितना लीटर प्लाज्मा चाहिए होगा? Simple सा question, right? Mathematics. A simple question of mathematics. For 5 milligrams, I need 5 liters, right? For 100 milligrams, I need how many liters? 100 milligrams, how many liters? 100 liters, very good. 100 liters, right? 100 liters. It means what? It means what? Now, if I remove 100 milligrams, you know that here there is 100 milligrams, here there is 5 milligrams, means the drug is 20 times more. The drug is 20 times more in tissues as compared to plasma. Now, if I don't know the milligrams, if I just know the drug has a volume of distribution of 100 liters, just this, then the drug is how many times more than plasma? For that, I have to divide 100 by which number? 5. And it becomes how much? 20 times. Right? 20 times. 20 times. Now, can you tell me what is the answer? A, B, C, or D? A, B, C, or D? What is the answer? Drug is 20 times less in plasma than tissue. Drug is 20 times more in plasma than tissue. Amiodarone is also PGP inhibitor. Yeah, amiodarone is also PGP inhibitor, but amiodarone does not act upon the P glycoproteins of brain. Basically, it does not cross. Right. So what is the answer now? Drug is 20 times less in plasma than tissue. Drug is 20 times more in plasma than tissue. This is see, the MCQ is not difficult. The English language is difficult, right? It is twisted. It is twisted. So English language का game है. Now the right answers, they have been flowing with some wrong answers, guys. देखो, here the drug is 20 times less in plasma than tissue. Drug is 20 times less in plasma than tissue. That means drug is 20 times more in tissue than plasma. So the reason why I have given it, I made the options in such a way so that, see, sometimes the options are made in such a way they are taxing. मतलब ऑप्शंस ऐसे बनाए जाते हैं कि डिफिकल्टी होती है उनको आंसर करने में, राइट? सो I'll give you a list of drugs blocking PGP. Don't worry. A patient of breast cancer. All right. कोई प्रॉब्लम नहीं. मोए हो रहा है. कोई दिक्कत नहीं. A patient of breast cancer is not responding adequately to tamoxifen. The reason could be due to abnormal. A patient of breast cancer is not responding. देखो, अगर आंसर नहीं कर पाते सही तो दिल पे मत लेना. दिस सेशन इज नॉट अ जजिंग टूल. इन सेशन में आपको जज नहीं करना कि आप कितने अच्छे हैं कितने बुरे हैं पढ़ने में. इस सेशन में ये लर्निंग टूल है. अगर मैं आंसर नहीं भी कर पाया तो कम से कम जो सही आंसर है वो सीख के जाऊंगा. व्हाट इज द राइट आंसर, राइट? इसकी वजह से अपना वो कम मत करो, कॉन्फिडेंस कम मत करो. दिस एमसीक्यूज आर डिफिकल्ट वंस, दिस आर न्यू वंस. बिकॉज ईजी एमसीक्यूज अगर मैं डिस्कस करूंगा तो सेशन का फायदा नहीं है कुछ. आई एम नॉट हियर फॉर कॉन्फिडेंस बूस्टिंग, rather I am here to teach you something new in this session, right? So which one is that? All right, so breast cancer. Remember, so I'll tell you a technique how to remember. The answer is CYP2D6. Very good, guys. So D याद रखना. D for depression. So all the drugs of depression and psychosis, all the drugs of depression and psychosis, all the drugs of depression and psychosis are metabolized by CYP2D6. Drug of breast cancer. So breast cancer कैसे याद रखेंगे? See, breast से क्या निकलता है? दूध निकलता है, right? दूध means milk. So breast cancer. So D, देखो याद करने का तरीका है. If you can remember and like that, it is good, right? Otherwise you can remember like this. So these are the drugs which are metabolized, psychotropic, depression, psychosis, and breast cancer drug tamoxifen is also activated. Now see, these are metabolized, whereas breast cancer drug tamoxifen is activated. Tamoxifen is activated. So it's an important one. देखो, out of these few points, most common enzyme for drug metabolism is CYP3A4. CYP2C9 metabolizes phenytoin and warfarin. It metabolizes phenytoin, warfarin. These are MCQs. CYP2C19, it activates clopidogrel and metabolizes omeprazole. And that is the reason why omeprazole is contraindicated with clopidogrel. So I've told you all of these. So these are four points which are important. Let me repeat once again. CYP3A4 is the most common enzyme for drug metabolism. This MCQ. CYP2C9 metabolizes phenytoin and warfarin. Right? CYP2C19 activates clopidogrel and metabolizes omeprazole. That is the reason why omeprazole is contraindicated with clopidogrel, because it would inhibit activation of clopidogrel. So once I have done here in these 4 points, I've revised all the important CYP enzymes which have been asked. right? Excellent, guys, excellent. Now moving to the next MCQ. A patient of Crigler-Najjar syndrome develops toxicity to irinotecan given to a patient at normal doses. The reason behind this interaction is, right? So Crigler-Najjar syndrome was given an anti-cancer drug irinotecan, and the patient at normal doses he was given, right, as to anyone. And even at those normal doses, the patient develops, right, toxicity. What is the interaction? All right, let us look at the options. Inadequate metabolism, increased absorption, receptor upregulation, pharmacokinetics. So what is the answer, guys? What do you think? Come on, come on, come on. You must answer, right? Even if you don't know, I'm not gonna award any marks here. मैं यहाँ पे कोई मार्क नहीं देने वाला किसी को, राइट? तो दिल खोल के आंसर करो. तो गलत होगा तो होने दो, गलत होगा तो होने दो, गलत होगा तब तो सही मार्क करोगे, राइट? So if you go wrong, it is okay. If you go wrong, it is okay, right? So mark whatever you feel is correct, right? Mark whatever you feel is correct. Excellent, guys. So right answers, they have started flowing, and the right answer here, it's inadequate metabolism. Inadequate metabolism. See, what happens in Crigler-Najjar syndrome, there is a decrease or deficiency of gluconoryl transferase, right? And gluconoryl transferase, it metabolizes two drugs, irinotecan and atazanavir. Irinotecan and atazanavir, right? So two drugs. So how to remember? How to remember? See, all of you know that I told this in my class as well. These are MCQs. So for example, Irina, right? Irina is a name of Russian girl. The Russian girl name is Irina. So suppose Irina went out to buy atta, and some guy like you were there, right? Irina went out to buy atta, and someone like you were there, and Irina को आपकी क्या लग गई? नजर लग गई, right? नजर लग गई. So estrogen is also there, but estrogen is not consequential here. That is the reason why these two drugs are important. So Irina आटा लेने गई, आटा जब लेने गई उसको नजर लग गई. So Crigler-Najjar syndrome, which are the two drugs, irinotecan and atazanavir. You need to remember these two are the MCQ points, right? All right. Now moving on to the next question. Infusion rate of a drug depends upon what? Steady state plasma concentration, clearance, volume of distribution, K elimination. Atazanavir causes Stevens-Johnson syndrome. Yeah, it can cause. Okay, so what is the answer? Infusion rate of a drug depends upon steady state plasma concentration, clearance, volume of distribution, and elimination constant, K elimination. Right? Upon what infusion rate of a drug depends? Infusion rate of a drug depends upon what? Right? Tell me. So infusion rate. So guys, do you remember what was the formula for infusion rate? I told you the mnemonic to remember infusion rate, the formula by mnemonic IPC, right? So I for infusion rate is equal to P for plasma concentration into C for clearance. Simple है, मैंने बताया था आपको. Infusion rate is equal to plasma concentration into clearance. Now see, for any disease, I take plasma concentration that is always steady state plasma concentration. And steady state plasma concentration for a drug for treatment of a particular disease has to be always constant, right? If it is lesser, there would be no effect. If it is too much high, there would be toxicity, which means what? This cannot change. So what is changing here? What is variable? Constant is plasma concentration. That means infusion rate would depend upon what? Infusion rate किस पर depend करेगा? Infusion rate किस पर depend करेगा? Clearance पर depend करेगा, clearance. So infusion rate depends upon clearance. Similarly, if you know, loading dose is equal to apparent volume of distribution into plasma concentration. So someone asked me, sir, what is loading dose? What is loading dose? Let me explain here. See, plasma concentration, again, it is steady state plasma concentration, which is constant. So even in this formula of loading dose, plasma concentration is steady state, it is constant. What is variable? What is variable is volume of distribution. Now, let us imagine a drug has very high volume of distribution. Now, to maintain steady state plasma concentration, I need to give high dose in this equation. And this high dose is called as loading dose, right? So loading dose, if they ask you an MCQ, loading dose depends upon what? What is the answer? Guys, Loading dose depends upon what? What is the answer? Infusion rate depends upon what? Clearance, right? Similarly, loading dose depends upon what? Loading dose depends upon what? What would be the answer? I've explained to you what is loading dose. So these are two MCQs on infusion rate and maintenance dose. Loading dose depends upon what? Come on, guys. Yes, Aman Singh, te Maladiyats. Amrita, very good. Very good, very good. ABD, very good, guys. Very good, very good. All of you, very good. You have given the right answer. Apparent volume of distribution, right? Apparent volume of distribution. All right, guys. So you have studied well. I can see that. All right. Now let us solve a difficult MCQ. Which of the following drug toxicity can be seen in liver cirrhosis due to low albumin binding? So again, it's a clinical MCQ. It's a clinical MCQ related to plasma protein binding that I've made. This is a new MCQ. एक नया क्वेश्चन मैंने बनाया है जो रिलेटेड है किसको? प्लाज्मा प्रोटीन बाइंडिंग को, राइट? एल्बुमिन बाइंडिंग को. सो विच ऑफ द फॉलोइंग ड्रग टॉक्सिसिटी कैन बी सीन इन लिवर सिरोसिस? सॉरी, ये लो टू लो ड्यू टू है. इट इज ड्यू टू लो एल्बुमिन बाइंडिंग. सर जी, और कितने एमसीक्यूज बचे हैं? क्या हो गया? बस मतलब अभी तो मैंने कितने एमसीक्यू करे हैं? मैंने 9 एमसीक्यू करे हैं. 9 में पसीने छूट गए क्या तुम्हारे? राइट, आई हैव डिस्कस्ड ओनली 9 एमसीक्यूज अप अंटिल नाउ. सो देयर आर 6 मोर. ऑलराइट. सो देखो, ये क्वेश्चन डिफिकल्ट है, मैंने जानबूझ के बनाया है, लेकिन ऐसा नहीं है कि मैंने नहीं पढ़ाया है. मैंने पढ़ाया है आपको. आई हैव टॉट यू दिस. आई एम नॉट आस्किंग दिस फ्रॉम आउट ऑफ बॉक्स, आउट ऑफ द वर्ल्ड, राइट? This is something I have taught you. This is something I have taught you. And all right. Now see, here plasma protein binding. Plasma protein binding. If you have not studied from me, अगर आप मेरे से नहीं पढ़े हो तो उनके लिए बता रहा हूँ. जो मेरे से पढ़े हैं वो आंसर कर रहे हैं, उनको पता है. Plasma protein binding. There are two types of plasma protein: albumin and alpha-1 acid glycoprotein, right? Alpha-1 acid glycoprotein. Now, which drugs bind to albumin? If you cannot remember everything, at least remember A for antibiotics, like penicillin, like sulfonamides, right? They bind to albumin. Anti-aggregant and anticoagulant. Anti-aggregant is aspirin, anticoagulant is warfarin. It binds to albumin. So, all right, I don't want to remember everything in this world. Oh, it's okay. Can I at least remember A for albumin and A for antibiotics and A for anti-aggregant, anticoagulant? बस इतना याद रख लेना, right? Alpha-1 acid glycoprotein, it binds to most of the antiarrhythmic drugs. Most of the antiarrhythmic drugs, right? So, कम से कम इतना याद रख लेंगे हम. Now see what happens if there is a patient of liver cirrhosis. If there is a patient of liver cirrhosis, you know who makes albumin? Liver. Cirrhosis में liver चला गया. No liver. Liver is not functioning well. So there will be a decreased albumin in plasma, right? And that would increase free drug. Increase risk of toxicity of these drugs which bind to albumin, the antibiotics, the anti-aggregant aspirin, the anticoagulant warfarin. So there would be a risk of bleeding. Yeah, antiarrhythmic drugs like beta blocker, etc. can be there. So I've just given you a simple explanation as to why this will be the answer, and this is clinically relevant because tomorrow when you go to practice medicine, there would be a lot of patients of liver cirrhosis. Why liver cirrhosis cases are going to increase? Every year they will increase. It is on increasing trend. Liver cirrhosis is on increasing trend. The reason being, use or abuse of alcohol is becoming much more common in today's generation, and we are becoming Western culture, right? So if I tell you, I belong to a state called as Odisha, and in Odisha I had never seen an alcohol shop near my house or in my city. I had never seen one. Right. For the first time I saw alcohol shop when I went to Bhubaneswar. Right. So the density of alcohol shop were very less at that time. But now in Odisha, you can find alcohol shop in each and every place. And the reason is the government wants money, tax. So imagine in our state, There is a competition. There is a competition. The shop that would sell maximum, volume of liquor will win a cash prize, right? All right, guys. So this is what is happening, guys. All of you know that. And anyways, where can I get Sir's lectures? See, my lectures are available in Mero. You can go to Mero. You can see those lectures, right? Or in offline classes, wherever I take. All right, guys. Which of the following statement is false? So every exam has a at least 50% chances of one MCQ on DRC, dose response curve. So we cannot avoid an MCQ on DRC today, right? In fact, I have two of them. Right? All right, guys. So proud to be ODI. See, we're proud to be ODI. I'm proud to be an Indian. I like to say, because I feel that all states. First I'm Indian. And I'm proud to be an Indian. Then second, I'm an ODI, right? That is what we should feel about ourselves. काश गांधी जी होते तो क्या करते भाई, लठ लेके घूम रहे होते. No, Pharmally site you can get, because Pharmally site I've discontinued. Because I'm not able to update those lectures because of lack of time. Because I have to record for Mero, I have to record for some nursing app as well, offline classes. I'm not getting time, right? All right, guys. So which of the following statement is false? All right, guys. देखो यहाँ पे ना शायद मैंने if I think I have made the MCQ wrong. All right, let us look at these options one by one. A and B act upon same target. It is true or false? A and B act upon same target is false. Is false because for two DRCs to act on same target, they should be parallel. They should be parallel to each other. For example, here B is parallel with D. So B and D are acting upon same target. A is somewhat parallel to C. So they act upon same target. That means for acting on same target, I need parallel DRCs. Simple याद रखना, अगर DRC parallel होगा तभी होगा. A and B are equipotent is wrong. It is false. Potency here, A more than B more than C more than D, right? A and B has same efficacy. This is true. A and B has same efficacy. This is true. Their height is same. D is more potent than C. This is false. Because C is more potent than D. I've already told you, right? All right, guys. So what is the answer here? What is the answer? So let me see. Have you guys given the right answer? So अच्छा, question मैंने गलत बना दिया. I should have made the question, which of the following statement is true, right? Anyway, so this, see, I told you I make these questions, and sometimes true false में सिर्फ आप लोग नहीं फंसते, टीचर्स भी फंस जाते हैं मेरे जैसे मैं फंस गया इस ऑप्शन में. सो मैं खुद बना रहा था फॉल्स और ट्रू, और मैं खुद फंस गया अपने बिछाए हुए जाल में. मैं खुद फंस गया. आज इस जाल में मैं आप लोगों को फंसना चाहता था, मैं खुद ही फंस गया, राइट? So which of the following statement is true? The answer is A and B has same efficacy. So anyways, so I told you once that what are the three things you need to know: efficacy, potency, and if I can compare. See, I'll explain once again. Efficacy, you can remember, is at HELP, right? HELP help. Height of DRC is equal to efficacy. Right. So taller the graph, more is efficacy. Left is equal to potency. So more the graph is in left, more is potency. Right. More is potency. Why not B? Because A and B are not equipotent. It is false. The only true option is C. So that is why B is not the option. Moe. Yeah, moe. So height is efficacy, left is potency. If the DRCs are parallel, then they act on same target, and then I can compare affinity. See, affinity was never asked in Indian exams. For the first time, it was asked in FMGE exam, not even NEETPG exam. Affinity was asked last year in FMGE exam, right? So they act upon same target. So three things, right? So how we can see parallel? See, for example, how can you see parallel? For example, let us say uh, these are two graphs. Are they parallel or not? Yes, they're parallel. Now, see, suppose this is one graph and this is another graph. Are they parallel? No, they're not parallel, right? A and B has same efficacy. That is true. A and B has same efficacy because height of A and B is same, right? A is more potent as compared to B, as compared to C, as compared to D. Don't look at the root. Don't look at the root. Look at where they're moving above the root. So, for example, for potency, what you need to do, take any response and draw perpendiculars. So, when you draw perpendiculars, you can see which perpendicular is going to fall first. Origin does not signify anything, right? If they're originating from same point, that means nothing. If they're originating from same point, that means nothing. That means just that they were originating for, see, logarithm of dose we take. At a logarithm of dose, it means that here there is a response, and at 0 dose response was 0. But as I begin to increase the dose, right, the response begins to change like this at a particular dose, right? With this drug, the response is more at a particular drug as compared to drug B, right? So potency of A is more than B, but both efficacy is same. Right, so DM का exam ले रहे हैं FMG का. See, FMG exams, they have made it difficult, so we cannot do anything. So anyways, so at last, what I would say, what you need to remember is these points. Help, height is efficacy, left is potency. Height is efficacy, left is potency. Left does not mean if they're originating from same graph, then I have to see which one is originating towards the left hand side. If the DRCs are parallel, then only they act upon same target, and then only I can compare affinity. अगर इतना आपको पता है, if you know this much, you can solve any MCQ on DRC in this world, right? Having said that, let us move on to next question. Which of the following parameters can be extrapolated from the graph given? So it is another DRC. So I told you there are two MCQs on DRC today because every exam has at least one question on DRC. Alright, सार्थक पढ़िया बुझली सर, थैंक यू. यहाँ आज जाए मोर कन्फ्यूजन थिला. एटा कन्फ्यूजन समस्तंकर थाए, प्राय लोकंकर थाए, राइट? किंतु क्लास रे मु पढ़ी जेटा. I have taught this in the class to all of you. Alright, so look at this question. Which of the following parameters can be extrapolated from the graph given? From the graph given, efficacy, affinity, safety, potency. Right? What do you think? What is the answer here? Again, guys, this is something that has been asked earlier. So it is a PYT, previous year's topic, right? It's not PYQ. It's not previous year's question, but it is PYT, previous year's topic. I have just changed the way the MCQ is formulated. I have just made a new MCQ to ask you guys. So what is the answer here, guys? Excellent. Most of you have given the right answer. So here, what is this? Effect is seen in percentage of population, logarithm of dose. That means it is a quantal DRC. It is a quantal dose response curve. क्या है ये? Quantal dose response curve. And if I'm taking effect in 50% of population, it gives me ED50. And guys, if you remember, I've taught you this ED50. So I've told you this specifically. E for ED50 does not mean E for efficacy. ऐसा नहीं होता pharma में. E for ED50 is a marker of potency. So I'll not go into the details of why it is potency and all because we don't have much time here. So that is something I've taught you, or if you're following One Touch or any teacher's lectures, you can follow. See, I'm like, it's not that only if you've read from me, then you can do weekly pharma. It's not that. You can read from any faculty. All faculties are good, right? So I never bash any faculty for teaching or not. All are working hard. All they teach the same thing, right? So even if you're following any other teacher, you can still do weekly pharma with me, right? Which of the following is not a GQ subtype of receptor? So here I'm going to teach you a basic concept. So देखो, look at this. Try to tell me the answer. If you don't know the answer, you'll learn something important today. That even if you don't know GPCRs, still you can answer, right? Still you can answer. Which of the following is not a GQ subtype of receptor? Which of the following is not a GQ subtype of receptor? Sahil Khan, very good. Dose required to produce effect in 50% of population. Right? Which of the following is not a GQ subtype of receptor? Oxytocin, angiotensin, alpha 1, beta 2. Now see, again I have taught you this, how to find out the answer. See, GPCR, they might ask you they might ask you, is it GS subtype or GQ subtype, right? Now, if it is GS subtype, the smooth muscle, they relax. GQ subtype, smooth muscles contract. Basic concept. I'll not go into very detail here. Detail I've taught in the lecture. If it is GS subtype, smooth muscle will relax. If it is GQ subtype, smooth muscle will contract. All right. So if I know the physiological function of a receptor, I can always find out the answer. For example, oxytocin, it can cause uterine contraction, yes or no? Contraction of smooth muscle. Angiotensin will cause vasoconstriction, yes or no? Alpha 1 will cause vasoconstriction, yes or no? That means all these three receptors, they are causing smooth muscle contraction, means all of these are GQ receptor. But beta 2 causes what? Bronchodilation, vasodilation, uterine relaxation. Relaxation of smooth muscle, that means beta 2 is GS subtype. Beta 2 is GS subtype. So I've given you a weapon. I've given a weapon by which even if you don't mug up any receptor, you can still find the answer. You just have to go back to basic physiology and find out what is the function of that particular receptor in our body. Right, guys? So GSGQ, right? So I've told you this. All right, now let us go to antagonism. The antagonism represented in the graph is seen with, right? The antagonism represented in the graph is seen with phenoxybenzamine, aspirin, organophosphates, methotrexate. Right, so that's a basic concept. So what is this antagonism? Is it phenoxybenzamine, aspirin, organophosphates, or methotrexate? Which one will cause? So first of all, what type of antagonism is it? Is it competitive or non-competitive? Or competitive, reversible or irreversible? All right, let us first look at what type of antagonism it is. See, if the graph is running forward, it moves right because the graph is running. If the graph is running, that means it is competition is going on. And it is competitive reversible type. Competitive reversible type. So in competitive reversible, the graph runs in the forward direction, right? Competitive reversible graph runs in the forward direction. Now tell me, what is the answer? Is it A, B, C, or D? Is it A, B, C, or D? In other words, I'm asking which is a competitive reversible antagonist. I'm asking which is a competitive reversible antagonist. The simple MCQ, right? So what is the answer? Is it A, B, C, or D? ठीक है, अब तो बता दो यार क्या आंसर है? A है, B है, C है, D है, क्या है? अब तो आसान हो गया. Which one is competitive reversible? Now it is easy one, right? अब ग्राफ दिया, ग्राफ देख के डर जाते हो आप लोग. ऐसा डरना नहीं है, ठीक है? Now actually tell me what is the answer? Which one is competitive reversible? Either you know or you can rule out. You can rule out. Try to rule out an answer. I want all of you guys to comment. All of you must comment, right? सब comment करो. आंसर पता है, नहीं पता है, कोई बात नहीं. गलत हो जाएगा ना, हो जाने दो. यहां गलत हो जाने दो, कोई दिक्कत नहीं है. कोई किसी को जज नहीं कर रहा है यहां पे, ठीक है? We are not judging anybody. Alright guys, now the right answers they have started following. See, this is a bunch of irreversible drugs. I've told you this. Phenoxybenzamine is irreversible alpha blocker. Aspirin is irreversible blocker of cyclooxygenase. Organophosphates, irreversible blocker of ACHE. Now, which is reversible? It is methotrexate. So remember, nowadays every MCQ would not be a direct one, right? So in these sessions, I'll try to portray those MCQs which are indirect, which are difficult to solve, so that at least you can learn something in these sessions, right? कुछ नया सीखोगे वही. All right. Now see here I'm gonna ask you, I'm gonna teach you something different because I get this doubt frequently because there is an MCQ in Marrow where there are two graphs like this. There are two graphs like this, A and B, and there is an option in that MCQ. A and B are competitive reversible antagonists. Tell me, this statement is true or false? There are two DRCs there. This is a DRC. DRC is there, right? DRC is there. And the MCQ is A and B are competitive reversible antagonists. So tell me, is is this option true or false? So I'll clear something in your mind, because I know this would be a doubt in most of the students, right? Most of you will be having this doubt. So if I say A and B are competitive and reversible antagonists, is this true or false? Exactly, that is why I discussed. No, it is not true. It is not true. It is false. A and B are not competitive reversible antagonists. A and B are different drugs. A and B are different drugs. A and B are different drugs. It is not true. You can see drug plus antagonist. What is competitive reversible antagonist? Competitive reversible antagonist में ड्रग दिया, ड्रग के साथ एंटागोनिस्ट दिया तो ड्रग ग्राफ भाग गया. ये दो अलग अलग ड्रग के ग्राफ हैं. A and B are two different drugs graph. Did you get my point or not? So antagonism is when there is a drug and the drug is antagonized by some other drug, then the drug's DRC will change. These are two separate DRCs. These are two separate DRCs. If it is given A plus B, if it is given A plus B, then you can say B is antagonist of A, right? If it is A plus B, then you can say B is antagonist of A. You got my point, guys? So देखो, मुझे पता था सब गलत करोगे इसको, इसीलिए बहुत बेसिक सा कॉन्सेप्ट है. इट्स अ वेरी बेसिक कॉन्सेप्ट. और हर महीने एक बार ये मैरो का एमसीक्यू मुझे कोई स्क्रीनशॉट भेजता है कि सर ये क्यों गलत है A and B. So I hope you guys have understood the basic concept behind this, right? All right. Which of the following is not constant in a drug following first order kinetics, right? So it's a simple MCQ. First order, zero order, they always ask MCQ, right? They always ask MCQ. So anyways, so that is the most students they ask me, so I know this is something you guys will have doubt, and 100% of you answered wrong. 100%. That's a record. Right? See how to differentiate between reversible and irreversible. See, irreversible in irreversible antagonism. In irreversible antagonism, what will happen is, if this was the graph, then irreversible antagonism, the graph will decrease in size. So it is drug, this is drug plus antagonist, the graph will decrease in size, right? The graph will decrease in size. So which of the following is not constant in a drug following first order kinetics? Right? Kinetics का mnemonic, kinetics का कौन सा mnemonic भाई? So plasma concentration, very good guys. Plasma concentration is the right answer. So anyways, so who do not know, I'll tell you first order kinetics, what is constant? See, remember in first order, the first segment of nephron is constant. And all of you know what is the first segment of nephron? The first segment of nephron is PCT. Right, so in first segment of nephron is constant P. Now remember, P does not stand for plasma concentration. P stands for proportion of drug or percentage of drug eliminated per hour. C stands for clearance and T stands for half-life. At least I can remember this much. Right? So P for proportion, C for clearance. So PCT is constant. The first segment of nephron is constant in first order kinetics. Simple, right? Half-life is constant in zero order. All right. Pharmacoeconomics of a drug can be determined in which phase? So this is new MCQ. I have not taught you this point, but I've given this MCQ for a reason. In your exams, there would be some MCQs which are not in your notes. ये MCQ मैंने आपको नहीं पढ़ा, मतलब ये कॉन्सेप्ट मैंने भी नहीं पढ़ा है आपको, कोई और पढ़ा है नहीं पढ़ा मुझे नहीं पता, मैं ये नहीं पढ़ा था फार्माकोइकोनॉमिक्स यूजुअली आपको, राइट? बिकॉज MD फार्मा में MCQs आते हैं, आप में आज तक आया नहीं है. फिर भी आई मेड दिस MCQ फॉर वन रीजन. No matter how much you study, no matter whose notes you study, you'll still have new MCQs in your exam, right? You'll still have new MCQs in your exam. Pharmacoeconomics of a drug can be determined in which phase? If you don't know the answer, it is okay. It's a new MCQ. In exam, if you don't know, you leave this question or try to go for something which you can. All right. So phase 4 is not a bad answer. Phase 4 is not a bad answer, but phase 4 is not the right answer. The right answer is phase 3. So pharmacoeconomics, it means what? If I'm making a drug, will majority of the population be able to afford that drug or not? That I can determine in phase 3, right? Looking at, for example, I'll compare with what is the minimum basic income of the patients that I have in trial, right? So देखो तुक्का मारो, तुक्का मार के भी ठीक हो जाता है कई बार, तो तुक्का मारना भी जरूरी है। FMG में तो तुक्का मारना ही मारना है। Today I took a session for FMGs, and it was a motivation session for FMGs in Gautam Nagar, and I asked them from 300 questions what you did with 50 questions for which you did not know the answer, and they said for these 50 questions we marked any option I liked. Now that is a blunder. That is a blunder. For 50 questions, mark same option, right? Mark same option. So one said, sir, I marked for some I marked B, some I marked C. Don't do this. So either mark A or B or C or D in both the papers, right? That is something what you can do in MC exam. NEETPG, INICET I cannot do. I have to leave those 10, 20, 30 questions where I'm not sure of, right? All right, now guys, coming to the last question for today. Step criteria is used for orphan drugs, P drugs, Schedule H drugs, narcotic drugs, right? Next week, what is the topic? I'll tell you what is the topic next week. अभी थोड़ा सा इंतजार तो कर लो, थोड़ा सा तो पेशेंस रखो भाई, इस अभी खत्म तो होने दो, right? Step criteria is used for. Now this is an MCQ that has never been asked in NEETPG and INICET. This was asked in FMGE. Last year FMG question है, last year का FMG का question है. Now you can see FMG questions are not that easy, no longer, no more they are easy. Now people, for the heck of it, they would try to, derail FMGs saying that the exam is easy or they don't ask complicated question. Nothing like that. It's all bullshit. The MCQs are difficult nowadays, right? So you must have seen these MCQs. So why I'm telling this, even it is important for NEETPG and INICET, because see, FMG is conducted by NetBoard, NEETPG is conducted by NetBoard. So their Q bank is same, right? So guys, yeah, if you don't know the answer, it is okay. It is P drugs. P drugs stands for personal drug. P drugs stand for personal drug, right? So you learn something today new, add this to your notes. What is a personal drug? See, for example, a patient comes to you with upper respiratory infection, and to that patient you prescribe amoxicillin or azithromycin. Now let us say for most patients you prescribe azithromycin. Now that azithromycin for URI becomes a P drug for you. Or if you are prescribing amoxicillin, amoxicillin becomes a P drug for URI for you, right? Now how did you derive that azithromycin or amoxicillin should be P drug for upper respiratory infection? The criteria is called as step criteria, right? So first of all, I have to look at safety of the drug. Is the drug safe or not? For example, should I use aminoglycosides for URI? No, they're very toxic. They're not safe, right? Safety, tolerability. The patient can tolerate the drug or not, right? So for example, should I use linezolid for URI? Linezolid will cause bone marrow suppression, there will be infection. So it's never a first line drug. Patient cannot tolerate it, right? E for efficacy. E for efficacy. Now, efficacy wise, it means what? If I'm using a drug for URI, I need to use a drug that covers gram-positive negatives and atypical organisms, right? So amoxicillin does it, azithromycin does it. It mostly covers the atypical organisms. So these are efficacious drugs I can use. Should I use a sulfonamide, right? Right, like sulfamethoxazole? No, probably not. Why? Because it is mostly active against gram negatives, and it does not have activity against gram positive, right? And gram positive like pneumococcus can also cause URI, right? So efficacy. And tell me, what does P stand for? I will tell me, what does P stand for? Tell me, what does P stand for? The last question of the day. Who is going to answer to me? The last question of the day. What does P stand for? What does P stand for, guys? Come on, बताओ, जल्दी बताओ. कौन बताएगा? What does P stand for? Or cleared FMG first attempt. Many congratulations, guys. Those who have cleared FMG is good. Those who have not cleared, keep preparing. P for क्या है? P for क्या है? Last question आज का. P for formally. P for potency नहीं है, याद रखना. P for price है. So this is an MCQ they're going to ask later. P for potency. See, I don't have anything to do with potency. If a drug is less potent, I will use higher doses. So I have nothing to do with potency. For a clinician, potency is not a problem. Yeah, Only if you're changing from one drug to another drug, then potency you have to consider, because you'll change the dose. If a drug is less potent, then you'll be using high doses. If the drug is more potent, you'll be using less dose. For example, if I'm using methylprednisolone, right, like let us suppose I'm using 30 milligrams of methylprednisolone, then I'll be using 5 milligrams of dexamethasone. That is where potency comes in. Otherwise, here price is important. So this is where they will confuse you. P for price. Orphan drugs, all of you know what is orphan drugs. Drugs used for treatment of rare disease. Orphan drugs. What are Schedule H drugs? Schedule H drugs, these are drugs which are available only by prescription. These are called as Schedule H drugs. Narcotic drugs are which schedule drugs? Which schedule? Schedule X drugs. Narcotic drugs are Schedule X drugs. So देखो कैसे याद रखेंगे? H means what? H means hospital. So if you want a prescription, you have to go to the hospital, and that is why prescription. Schedule X, narcotropic drugs. So when people go to narcotics, when he loves somebody and she becomes X, so she becomes X, then you go for narcotic drugs because she's no more with you, right? So that is one way of just remembering, a technique to remember. So guys, this was the session today for G Pharma. Even if you could not solve all the MCQs right, even if you could solve only 1, 2, 3, 4, then also it is okay. अगर आप सारे MCQs सही नहीं कर पाए तो डरने की बात नहीं है. जानबूझ के MCQs मैं डिफिकल्ट बनाता हूं, लेकिन टॉपिक वही रहता है. आप ये नहीं कह सकते कि मैं इधर उधर के टॉपिक से पूछा है. वही एब्जॉर्प्शन है, वही डिस्ट्रीब्यूशन, सेम मेटाबॉलिज्म, एक्सक्रीशन, टॉपिक्स आर सेम, PYTs. So you have to analyze why were you not able to solve those questions in these sessions, right? Plus, once in a week I'll come live, and so that we guys can talk with each other. Plus, category X drug and schedule X drug. See, category X drug, category X drug is a teratogenic drug, and absolutely contraindicated in pregnancy. That is category S. Schedule X is narcotropic drug, right? Fastest absorption by IV or inhalation. See, fastest absorption. So I asked this MCQ in Instagram and I forgot. See, IV or inhalation, fastest. Now see here, IV will not be the answer. The answer would be inhalation, because by IV route, I don't need absorption. Do I need absorption by IV route? Right. I don't need absorption by IV route. So the MCQ that I asked you, I forgot to tell the answer there. Which route has fastest absorption? IV will not be the answer, because IV में absorption हो ही नहीं रहा. There is no absorption in IV. So answer is inhalation route. You got my point? That's all, guys. Alright, guys. So this is all the best for second week. Today I'll post on Instagram. I'll post in YouTube as well the schedule for next week. Next year's कह रहा हूँ. Next week's topic would be ANS. 5 वर्षीय योजना नहीं बनाना हमने. Autonomic nervous system. Spurious versus misbranded. देखो, spurious versus misbranded. I'll just give you a simple example to make you guys understand what is spurious versus misbranded, right? For example, जूते का लेते हैं example, जूते का example लेते हैं, shoe. Suppose all of you know Reebok makes shoes. Now, what would be spurious if some other company makes Reebok, all of you know, देखा आपने, Abibas, Reebok, right? So some other company is making Reebok, or some other company even is making Reebok, some other company, right? If the same company will make poor quality Reebok, तो याद रखो, तो Reebok जूता बना रहा है, Reebok की कंपनी बना रहा है, किसी ने Reebok बना दिया, उससे मिलता जुलता, वो भी स्पूरियस है. अगर कोई दूसरा कंपनी नहीं बना रही, कोई दूसरा चोरी करके Reebok बना रहा है, वो भी गलत है, राइट? Reebok ही बना रहा है, लेकिन क्वालिटी खराब है. वो जूता जो वो कहता है कि 3 साल चलनी चाहिए, वो 1 साल में खत्म हो जा रहा है, राइट? मिसब्रांडेड में क्या है? Reebok बना रहा है, Reebok ही लिखा हुआ है. अब Reebok में क्या लिखा हुआ है? Reebok में ये लिखा हुआ है कि भाई ये जो शू है, ये वाटर रेजिस्टेंट है, ये शू है वाटर रेजिस्टेंट है, तो शू वाटर रेजिस्टेंट है, लेकिन ये पॉइंट वो लिखना भूल गए वहां पे। मतलब जूता ठीक है, जूता बढ़िया है, जूता रिबॉक नहीं बनाया है, राइट, जूता वाटर रेजिस्टेंट भी है, लेकिन ये पॉइंट वो लिखना भूल गए। मतलब जूते के लेबल पे जो इंपॉर्टेंट पॉइंट है उसको लिखना भूल गए, देन इट इज कॉल्ड एज समथिंग विच इज मिसब्रांडेड। सो मिसब्रांडेड मतलब एनीथिंग रॉन्ग इन द लेबल, एनीथिंग रॉन्ग इन द लेबल। तो अब लेबल को ना ड्रग का लेबल, स्टोर इट इन फ्रिज, रेफ्रिजरेट, सो अगर स्टोरेज गाइडलाइंस आर मिसिंग, schedule H is not there, not written schedule H, so this becomes misbranded. Okay, I hope you guys have got this right. Sublingual versus inhalational. Inhalational is faster than sublingual. Inhalational is faster than sublingual, right? So one touch enough for pharmacy, one touch is enough for pharma if your basics are clear. If your basics are clear, and plus if you do one touch, you have to do MCQs as well. So you cannot just do one touch. One touch is a basic concise version of my lectures in Mero, right? That is good for revision. If the question is changed from absorption to onset of action, then answer will become IV, right? Onset of action, then answer becomes IV. Fastest effect, then IV. See, if effect is there, then IV. Absorption, then IV will not be the answer, right? Effect means onset of action or effect, then IV. Absorption, IV will not be the answer because in IV route, the drug is not getting absorbed. I'm giving the drug directly into systemic circulation, right? So fastest acting is IV, fastest acting is IV, fastest absorption is inhalational. तो इंग्लिश लैंग्वेज का प्रॉब्लम है, इंग्लिश लैंग्वेज का चेंज है इसमें, एब्जॉर्प्शन आ गया, इफेक्ट आ गया. आई होप दिस इज क्लियर. सो गाइज रिमेंबर द कोट फॉर टुडेज is hard work can compensate for intelligence, but intelligence can never ever compensate for hard work, right? So even if आप कहीं से भी पढ़े हो, wherever you are studied from, are you are an FMG or IMG from private medical college, you could not you paid you did MBBS from a paid seat, or you are from a peripheral university, it does not matter where you are from, right? If you work hard, then in these months or these 1 year, if you are preparing for 2025, or if you are an FMG, you can always work hard and you can always reach your goal, right? So you should always begin your preparation by a positive note, on a positive note, that why am I doing this? I'm doing this because I'm gonna clear the exam, right? That should be the positivity in your mind, and don't let anyone spoil your mood saying otherwise. All right, guys, so all the best to all of you guys, and this is what I have to discuss today. I'll post and today maybe at night 12 o'clock I'll come live on Instagram. FMG nights I do nowadays 12 o'clock because my night duties. I have a daughter 2 months old, so I take care of her till 2 o'clock at night. So I'll see you guys 12 o'clock on Instagram, and problem based other discussions I'll do, guys. Lots of love and blessings to all of you. Take care. Bye bye.